I have the privilege of welcoming Salma Meher. Salma is a specialist dietitian working in the field of community health and well-being for over 15 years. Her work has been acknowledged in many communities, improving health conditions such as type 2 diabetes, heart disease, and obesity through education and health promotion. Her role has extended working across the globe with various communities, teaching and developing educational tools and resources to improve the lives of local communities. Her passion to improve health through good diet and lifestyle has reflected in many projects led in religious establishments. She has worked with a number of charities to promote healthy living and improving inequalities in healthcare accessibility. Can we please welcome her with a loud salawat?
Assalamu alaikum, everybody. Thank you very much for inviting me here today. So just a little bit about myself. Sorry. It's okay. Assalamu alaikum. Thank you all for inviting me here today. Now, I'm working as a specialist dietitian in the field of diabetes, but one of the reasons I'm here today is to share a personal experience with you and also share my experience and the passion of prevention of diabetes. So I just wanted to starting with a small story that where my journey began. Growing up, my mother suffered from a lot of health problems, and I was escorting her with a lot of health clinic appointments, and a lot of appointments in the hospital. And one of the things I came across was that there was a huge cultural barrier between the clinicians and my mum. And a lot of the clinicians didn't really understand what my mum was having, what her diet was like, what she was eating, what her cultural beliefs are, and how to address the concerns around diet. And that was one of the main reasons I decided to become a dietitian and also then specialize in ethnic health. And now I currently do a lot of education and teaching to a lot of communities on diabetes and the management of long-term health conditions. Now, I've been working for over 15 years with a lot of ethnic minorities, in particular South Asians. Now, I'm quite privileged to speak a lot of the languages and have a good understanding of South Asian communities. But what I come across is that there's a lot of disengagement and a lot of low health literacy amongst our communities. And that really upsets me that why is it that our Asian communities, why is it South Asians are suffering from these long-term conditions? Now, if we just look around us or if we speak to somebody next to us, you might hear someone's got diabetes, cholesterol, blood pressure, and it's become a norm. It's so normal to have these conditions. But I ask myself, why is it normal for South Asians to have these problems? Is it because of our diet? Is it because of our lifestyle? Or is it because we're Asians? But my role is to educate people. And that's what I've been doing for 15 years. But now I think it's time for me to do more than that and stand up and ask, why is it that this should continue? Now, just to tell you a little bit of statistics about diabetes. Diabetes is very common amongst South Asians, you might all know, but it's 6 times more likely to develop in South Asians than our Caucasian counterparts. And also with diabetes comes heart disease. Now the two together can reduce your life expectancy. Now within Muslims, we strongly believe that life is from Allah and life can be taken at any time. But if we suffer from these conditions, we are going to reduce our quality of life. Yes, life is from God. We don't know how long. But if we do have these long-term conditions, we are reducing our life expectancy and we're also reducing the quality of life. So why is it that we should suffer? Why should Asians suffer with these conditions? Why are we not taking responsibility of our health and our communities? Why are we not doing anything about it? And this is the main reasons I was asked to come and speak to our communities today, to think about what we can do as a community to prevent these long-term conditions. And the saddest thing is that our children will probably develop these conditions much sooner than we have. So if we don't act now, they will head into much more complications at a younger age than our forefathers have. I also like to say that we take a lot of pride in our children becoming healthcare professionals. Doctors, nurses, dietitians, opticians. We all do very well as Asians. But what are we doing? We're actually treating these conditions. We're not actually doing much to prevent them. We're actually relying more and more on pharmacotherapy. We're quite happily going to secondary care prevention. But what are we doing as clinicians, as doctors, as dietitians, as nurses, to actually prevent these conditions? I ask my doctors when I go to clinic in the morning, I pick up my list. A majority of my list, I go through the list in our clinic, and everybody in that list is Asian. And I really feel, why is this happening? And these people are coming with complications, with renal problems, with foot problems, with eye disease, with heart disease. Why is it that we are not taking responsibility of our health as Muslims? Why is it that we are relying on our GPs, on our doctors for information or to look after us? But as Muslims, we need to start thinking what we can do to improve our health and to prevent these long-term complications. As a community clinician, my role is to increase the awareness of diabetes and focus on the prevention and the risk factors. And one of the things that I see a lot of now is the growing concerns of obesity, and particularly in Muslim men. And is this being addressed? What can be done? Or is it normal? And particularly amongst the Asian communities, we see more and more increase of obesity and diabetes. However, as an educator, I believe that everybody who is diabetic or suffers from any long-term conditions should receive some sort of education, either when they're diagnosed or at any stage of their illness. But what I will say is that I also find that there's very low engagement amongst our communities with primary prevention. And I really need to understand why this is. Now, one of the reasons I see this is because, firstly, of disengagement in the community due to language barriers, and also because of lack of understanding of people's cultural and religious dietary beliefs. So over the years, what we have done is we've worked very closely with communities, and we've also worked with communities such as yourself, looking at what people's needs are and how we can actually address these concerns. Working with the communities can actually help you in the long term as well. So what better month to start in Ramadan? So Ramadan is a time to focus on not only on our attaining spiritual health, but also physical and mental well-being. We all know about the Islamic requirements of fasting and its spiritual angles, but I think this is a time to really think about how we can improve our long-term dietary habits, think about the good foods, and how these foods can improve our minds, our souls, and our body. Through fasting, we can learn how to manage our eating habits and improve self-discipline. Fasting is not an endurance test of how well we cope without food and water. It is a fundamental pillar of faith and strength and our relationship with Allah. So we should be mindful of how we eat and how we look after our body, soul, mind, and soul. So the messages of how we can attain a recipe of a healthy faith and healthy life. Starting off with cleansing our mind, having clear mind and avoiding negative thoughts. Positive thinking and positive thoughts can inspire you to eat well and keep well. Detoxing your body by staying hydrated, drinking plenty of water, replacing caffeinated drinks or fruit juices with water, milk and coconut water. Eating nutritious foods, preferably at home, including lots of fruits, vegetables, fiber, cutting down on salt, fat, and white starchy foods, avoiding fried foods, and also the unnecessary junk foods or takeaway. Also thinking about taking regular walks, and also thinking about taking short naps so we can energize for our prayers during the evenings. We have 30 days to purify our souls, and through this we can change the world. Now is the time to start thinking and acting to prevent our future generations from getting the diseases of the long-term conditions that we see today. If we act today as a community and we all stand up, we can prevent our children and our future generations getting the long-term conditions that I see in my clinics today. Thank you very much.